All right, now let's focus on some health news this morning. This morning, we're going to talk about strokes. And believe it or not, I was surprised to hear this. Did you know that every 40 seconds, someone is actually having a stroke? Well, Dr. Leffler from AdventHealth is joining us this morning to talk more about this. And when you hear that number, doctor, I mean, I literally took a gasp. I cannot believe that many people, that they're that common. But I guess you're not surprised to hear that.
Yes, we see it very often, and about 795,000 people per year have a stroke. That's the incidence, and of that, 87% are from a blockage of one of the head vessels, and that's what we primarily fix in the hospitals.
So my first question when we were started talking with you, doctor, was when you think of the pandemic and everything that's going on right now. I know some people were putting off some visits, and what is it that you really want people to know this morning when it comes to strokes and knowing the signs and making sure that you're getting seen and getting questions answered right away, even in the midst of what we're dealing with right now?
The most important thing is that if you feel that you're having a stroke, or if you feel that one of your loved ones is having a stroke, to definitely call 911 and go to the hospital and let the professionals decide whether or not you're having a stroke. Because if you wait too long, the chances of irreparable damage to your brain get higher and higher as the time goes on. So do not wait, and do not think it's going to get better. And do not think that you're not having a stroke if you are having some sort of new neurologic changes.
So let's talk about that. What are some of the main symptoms and some of the things that, people might notice right away that would say, hey, I need to do something about this now?
So the easiest mnemonic that you can use to remember the symptoms of a stroke, because not every person is going to remember every single symptom of a stroke, is FAST, F-A-S-T. So the first one would be facial weakness or drooping. The second one would be, which would be the A in FAST, would be arm or leg weakness. The third one would be, which would be S, would be speech, and that would be either being able to speak or being able to receive speech and understand it. So if you're talking to one of your loved ones and they are not talking back, not because they don't want to talk to you, but because they can't understand you or figure out what's going on, that could be a sign of a stroke. And then the T in FAST is time. Do not waste time if you're having any one of those symptoms of a stroke that we talked about in the FAST.
So let's talk about what that treatment is and what the recovery is like. I mean, I guess the good news is if you are able to maybe get ahead of it as fast as you can, how do you treat it?
So there's initially, we have to recognize that a person is truly having a stroke and exclude all those other forms that could mimic a stroke, like seizures or stuff like that. And once we correctly diagnose that they are having a stroke, we first do a head CT, which is a CAT scan of the head, to make sure that that stroke is not from a bleed. It's actually from not having enough blood supply to the head. Because there's two main types of a stroke: if you bleed inside the head, and then if you are not having enough blood supply to the head, which the most common cause is not having enough blood supply. But if you are having that type that is not enough blood supply, we diagnose it initially by excluding other things by the head CT, and then what we do is we do we put dye in your blood vessels to see where that blockage is inside your head and how much tissue is actually salvageable and how much tissue is actually dead. But before we do the CT, looking at the blood vessels of the head, if they meet the criteria for having a stroke, the neurologists see the patients and they give a clot-busting drug to hopefully break up that clot. Okay. And that clot-busting drug is usually TPA. If they do not recover from that blockage from using that clot-busting drug after a half an hour, we will take them up to the lab and do. You basically it's plumbing of the head. In other words, we identify where exactly the blood vessel is blocked, and we go up there with a small it looks like a Chinese finger trap. It's actually one of two devices called a stent retriever, where we deploy a stent within the clot. We let it sit for about 5 minutes, and we pull the stent retriever out, and it ensnares the clot, and it pulls the clot out of the head.
Yeah. Well, doctor, thank you so much for your time this morning. I mean, it's truly, as we said, 40 seconds, every 40 seconds, someone
every 40 seconds.
Yeah.
And it could be any age. Usually, the older you are, the more common it is.
Yeah.
In fact, women get it more often than males because they live longer. But any age can have it. And if you're having new neurologic symptoms, like we spoke about with
Yeah.
the fast, you need to call 911 if it lasts more than 5 to 10 minutes.
Well, we've been showing the website, certainly the phone number too, for more people to get information. Doctor, again, thank you for your time and again for sharing hopefully this life-saving reminders and advice.
Yep, and we're always open. So there you go.